For reasons we don't understand, there's never been a yellow fever epidemic anywhere in Asia. It's always been sub-Saharan Africa and Latin America. And years ago, almost a century ago, there were large yellow fever outbreaks in the United States, in Philadelphia, in New York, in Memphis, in New Orleans. But that's not the case anymore because controlling the mosquitoes and improving hygiene. So there's never been yellow fever epidemics in Asia, even though the mosquitoes that spread yellow fever are in Asia, just like they're in Latin America, just like they're in sub-Saharan Africa, spreading other diseases that occur in all three continents, like dengue fever or chikungunya or Zika virus. Those all happen in Asia, but for some reason, there hasn't been any yellow fever. So, epidemics. So I think that we should plan now and start stockpiling vaccine now in anticipation of yellow fever epidemics in Asia. And the reason I say that is because during the yellow fever outbreak in Angola, there were 11 people working in Angola who were from China who got infected with yellow fever and then decided to fly home to China, where they were diagnosed with yellow fever. So these are the first people ever to have documentation, laboratory documentation, that yellow fever infection anywhere in Asia, China or otherwise. But it was in March and April when the mosquitoes, it was too cold for the mosquitoes to bite and to transmit the yellow fever virus from any of these 11 people who came back from Angola to other people in China. But next time we might not be so lucky, and it may not be China, it might be anywhere else, India, Pakistan, Indonesia, Philippines, Korea, etc. So anywhere where the Aedes mosquitoes are that transmit yellow fever or dengue or chikungunya or Zika. So I think that the global community, the World Health Organization, and perhaps some countries like China might want to start, or really in my opinion should, start stockpiling vaccine in the event of an epidemic in Asia.